name is Tim Rogers, RN, and I'll be guiding you through this brief presentation surrounding the Health Insurance Portability and Accountability Act, known more commonly amongst healthcare professionals by the acronym Hipaa. We've created this presentation on behalf of the RN to BSN program at Jacksonville University in Jacksonville, Florida. This video will define Hipaa, provide a brief insight on its history, how it pertains to nursing, its impact on healthcare, how it benefits the patient, how it has evolved with the evolution of technology, penalties for violations of Hipaa, and its future in healthcare. Please stay tuned for the remainder of this video. Hipaa, the client, and the nurse. Nurses and other healthcare professionals have long been morally and ethically responsible to protect their clients' right to privacy and to maintain confidentiality. With the implementation of Hipaa legislation, nurses have a primary role in helping clients understand all of their rights. According to an article in Health Leaders magazine, medical errors expert Robert Wachter, MD, suggested patients will benefit from Hipaa because the laws require hospitals to implement information technology that provides universal access to standardized patient information so that all practitioners providing care to a patient are on the same page, thus drastically reducing medical errors and promoting continuity of care. The impact of Hipaa on healthcare. Initially, it was thought that Hipaa would decrease costs for medical institutions across the board. An increase in cost was most certainly noted. Moving from paper-based systems to electronic-based systems in healthcare caused many to assume that the costs would go down. However, shortly after Hipaa's privacy rule and compliance initiatives went into effect, administrative staff nationwide realized that costs were rising. This was due to an increase in education and training of staff and the hiring of new people to implement the privacy rule. Potentials for a lack of understanding by covered entities resulted in unintended Hipaa violations. It's important to note that an increase in patient education, healthcare professionals including nurses, physicians, administrative staff, and health information management professionals should all be participating in patient education of Hipaa so that the patient can be proactive in protecting his or her own PHI as well. Better patient outcomes. If patients are confident that their information is safe, they can focus more on recovery. How Hipaa benefits the consumer. Hipaa benefits the consumer by ensuring that patients have access to their own medical records. It benefits the consumer by ensuring that personal health information is protected from those who aren't authorized to see it. Individuals, including those with pre-existing conditions, are able to obtain health insurance when changing jobs. Healthcare is provided more quickly due to information being exchanged electronically. Providers and consumers are immediately aware of a breach in PHI security, and tracing the source of a breach is made easier with the implementation of secured electronic storage. Nursing informatics and protecting patient privacy. Hipaa laws mandate that nurses have an obligation to protect the patient's information from being seen or talked about by anyone who does not have a need to know. That means that nurses working in a facility must not leave electronic records open on the computer, and nurses working outside the hospital, such as in home care, must always be in possession of any patient records. In the event that a facility uses paper charting, a nurse must always be sure to not leave the paper charting open and available for public eyes to see. It is absolutely crucial that we protect all aspects of patient care and personal health information. Understanding your facility's policies. As electronic capabilities continue to grow and information technology takes a stronger role in healthcare facilities, the rules pertinent to enforcing Hipaa regulations will continue to emerge and change. It is vitally important that nurses have a decent understanding of their facility's rule and policies. It's important to note that most facilities have individual rules regarding patient exchange and information. However, across the board, most of those rules maintain the same consistency. Penalties for Hipaa violations. The American Recovery and Reinvestment Act of 2009 was signed into law in February of 2009 and established a tiered civil penalty structure for Hipaa violations. Note that the maximum penalty of $50,000 per violation with an annual maximum of $1.5 million can be assessed at any phase in Hipaa violation. The Hipaa violations are as follows. Individuals not knowing and by exercising reasonable diligence could not know that he or she violated Hipaa. There's a minimum penalty of $100 per violation with an annual maximum of $25,000 for repeat violations. For a Hipaa violation due to reasonable cause and not due to willful neglect, there is $1,000 per violation with an annual maximum of $100,000 for repeat violations. For Hipaa violations due to willful neglect, but violation is corrected in the required time period, there is $10,000 per violation with an annual maximum of $250,000 for repeat violations on a minimum penalty. A Hipaa violation that is due to willful neglect and is not corrected is $50,000 per violation with an annual maximum of $1.5 million per minimum penalty. Further penalties. In June 2005, the U.S. Department of Justice clarified who can be held criminally liable under Hipaa. Covered entities and specified individuals, as explained below, who knowingly obtain or disclose individually identifiable health information in violation of the administrative. Simplification regulations face a fine of up to $50,000 as well as imprisonment up to 1 year. Offenses committed under false pretenses allow penalties to be increased to a $100,000 fine with up to 5 years in prison. Finally, offenses committed with the intent to sell, transfer, or use individually identifiable health information for commercial advantage, personal gain, or malicious intent permit fines of up to $250,000 and imprisonment for up to 10 years. The future of Hipaa in nursing. Nurses and all who provide care are entrusted with the patient's health information solely to be of service to that patient. It is our duty to protect the well-being of those who are entrusted to our care. Protecting the integrity of the nurse-patient relationship and patient rights is a sacred trust. The implementation of Hipaa and the implications of this act for nurses have been discussed. As technology evolves, so too will the challenges to maintaining privacy and strategies for promoting privacy. When the Hipaa regulation initially went into effect, it generated significant skepticism, confusion, and even angst. Many in the healthcare industry asked, would it be possible to provide efficient healthcare and comply with all of Hipaa's requirements? What did protecting the confidentiality of protected health information mean? How would Hipaa be enforced? Would Hipaa interfere with the relationship between patients and healthcare providers? 10 years later, these questions have largely been answered. Hipaa has evolved during the past decade and was greatly fortified by the 2009 HITECH Act and its Hipaa modification regulations released in January of 2013. Whatever one might think about Hipaa, it is hard to dispute that it has had a vast impact on patients, the healthcare industry, and many others over the last 10 years, and it will continue to shape healthcare for many more years to come. As part of the American Recovery and Reinvestment Act era, Congress passed in 2009 the Health Information Technology for Economic and Clinical Health Act, HITECH. The HITECH Act greatly strengthened Hipaa by dramatically increasing the penalties for Hipaa violations, up to $1.5 million per violation in certain circumstances. It is important to note that fines were significantly increased due to statistical information available to Congress that a vast majority of Hipaa violations and fines were paid out amongst healthcare affiliates and corporations that were not directly involved with the care of patients. The exchange of information and violations of Hipaa were occurring at levels outside the clinical arena. New issues that are emerging, which might require special consideration, include the burgeoning use of social media by healthcare personnel. Hipaa rules clearly forbid disseminating patient information on social media, but they say little about the kinds of measures healthcare providers can take to get a handle on this problem. Mobile devices and unencrypted laptops remain a great challenge to healthcare privacy and security. In closing, we'd like to thank you for taking the time to watch this brief video and encourage you as healthcare practitioners to always maintain personal health information as sacred in observance of Hipaa. Your cooperation helps to instill and maintain a consistent bond of trust which is required to provide excellent patient care. Thank you.